Important health news out today about breast cancer. That tops our look at today's health. A new study shows weight is an important risk factor in determining if a woman will suffer a reoccurrence, and losing weight after diagnosis can lead to better outcomes all around. Researchers also say they have linked a lack of sleep to more aggressive breast cancers. Data on over 400 breast cancer patients revealed women who averaged less than 6 hours of sleep a night before their diagnosis had more aggressive tumors than women who slept longer. And studies looking at the risks of various forms of birth control are constantly underway, but the results from all of the studies can be confusing. Should you worry about your birth control risks? Christy Nelson explains.
Dr. Cherise Wiley did something lots of women do. She switched birth control pills to save money, opting for a cheaper alternative.
I was on one type of birth control, and in order to save costs, I was a resident at the time, I increased or changed my birth control, which increased the estrogen.
Estrogen increases the risk for blood clotting, and within a month, Wiley's decision had turned the doctor into a patient. She had chest pain and shortness of breath.
I was found to have a PE. As a matter of fact, I had multiple PEs, which are blood clots in the lungs. So I had that immediately. I was admitted into the hospital, had to be on blood thinner for a course of about 6 months to a year's time, and it was quite an experience.
Wiley has a disorder that makes her more prone to blood clots, which she didn't know about before. It pushed her risk factors over the line.
That's extremely rare. But when you hear those episodes of things like that happening in a very, very young woman in reproductive ages, it's a pretty devastating event.
Blood clots are just one of the risks associated with contraceptives. Dr. Leanne Haddock says studies are constantly underway examining the risks of various products.
They all have different pluses and minuses, and every person is different which one's going to work for them.
But all of the results from those studies can be confusing for women. For example, in May, a study in the British Medical Journal said non-oral contraceptives like rings, implants, and skin patches carry a higher risk for blood clots than pills. And in June, a study in the New England Journal of Medicine reported that birth control pills with a mix of both estrogen and progesterone can double a woman's risk of having a heart attack or stroke. Dr. Haddock says the bottom line is that all of these risks are rare. In 9 years, she's only seen 2 blood clot cases related to birth control.
The hormonal contraceptives all have side effects. There is nothing that is perfect, so you really have to decide which one works the best for you.
We are back in studio for our segment of Today's Health, and joining us this morning for this segment is a guest from ISU, Brandon Payne, an athletic trainer. Thank you so much for being here this morning.
Thank you for having me.
Now with the start of football, volleyball, it's just the start of all of the great sports in my opinion, but that also can come with some dangers for athletes. So today, for Today's Health, we're going to be talking about concussions.
Yes.
And first off, what is a concussion, and how can people detect when an athlete has one?
The way they describe it usually and easiest is it's a disturbance in the brain caused from a blow or a shaking of the head. If you think about it, the brain's like an egg yolk. It can shake inside and hit the sides. So it leads to the chemicals basically being thrown out of where they should be in your brain. And then it takes time for your brain to try to process where those are supposed to go, get everything back in order, and basically clean your brain up.
And what are some of the minimal results of a concussion, but then some of the extreme effects that can happen from the concussion?
Usually the minimal results, most people have headaches, feel nauseous, and those are kind of your easy symptoms to pick up on. And those are the hard ones too, because you can have those and technically not have a concussion, is what they state. But it leads to long-term effects. If you get a second one before your first one heals, it's led to people becoming basically vegetables. So it's really difficult, and the best way we always tell parents and people to really know if you might have a concussion is know the athlete or know your child, and if there's any changes mentally in them, they don't seem like they're themselves, get them checked out.
And as a parent, it's so hard, especially, you know, if your athlete's out there on the field or the court and they're doing so well, but they may have had a head-on collision with another athlete or something. What precautions or steps should parents take besides, you know, knowing their child and kind of maybe pulling them out of the game and making that hard decision to do that?
It's tough. You know, the athletes want to be out there playing, and the coaches want them out there playing, but with the new laws that are being passed on coaches being educated about it, referees and athletic trainers and stuff, it's almost required that if you think a concussion has happened, they're pulled out of competition until they're seen by a medical professional. So it really comes down to thinking long term of that athlete. Yes, they're going to be mad at you possibly for a short term, but we want them to be able, when they're our age, to be able to play with their kids and remember things and not be having to go to hospitals for regular therapy because they can't hardly talk.
Now, to wrap up, what are some of the remedies parents should be doing if their child does suffer from a concussion?
The best remedy is rest. We always tell athletes, stick away from phones, television, music. Really almost close yourself off, make it dark, quiet, and just let your brain heal. Sleeping can be one of the best things. They used to say wake them up every 2 hours and stuff like that. If you don't think it's severe where they're having issues, let them sleep all night long because it allows the brain to basically shut off and reboot itself.
Wonderful. Brandon Payne, thank you so much for being here this morning. And